Assalamu alaikum. My name is Sumema Raza. My roll number is PP1650215. The topic which is assigned to our group is acute drug toxicity. The subtopic which I'll be making my presentation on is hallucinogens. Our group number is 5 and the course is Pharmacy Practice PHC 602. Introduction. Hallucinogens are coined from the word hallucinations. Hallucinations was initially a Latin word which was called as hallucinare, and from the word hallucinare, hallucinations were derived. Hallucinogens can be considered as indole alkylamines, phenethylamines, and these are those psychoactive agents that causes or that are responsible for hallucinations. Hallucinations are basically those substantial subjective changes in thought processing, emotions, and consciousness. These hallucinations are not typically experienced with such degrees with any other drug classifications, but they are primarily categorized under hallucinogens. The common classifications for all the hallucinogens are psychedelics, deliriums, dissociatives, etc. Examples which may include are seeing things which are not apparently there, hearing voices, experiencing body sensations, etc. Now, moving on to the type of hallucinations. Hallucinations are of different types, such as visual hallucinations, auditory hallucinations, tactile hallucinations, or olfactory hallucinations. Hallucinations does not only cover our visions, but it also cover our different senses, be it of smelling, be it of hearing, or be it of our sixth sense. Talking about the visual hallucinations, it involves seeing things that are not there. For example, you might see a person who is not in the room, or you might see flashing lights that no one else can see. Auditory hallucinations. Auditory hallucinations are the most common type of hallucinations. You might hear someone speaking to you or recommending you or commanding you to do certain things, which are apparently not true. Olfactory hallucinations. Olfactory hallucinations involves your sense of smell. You might experience a bad odor while waking up in the middle of night, or all of a sudden you feel like your body smells bad and you are stinking. So this type of hallucinations are under the heading olfactory hallucinations. The last but not the least, tactile hallucinations. Tactile hallucinations involves the feeling of touch or movement in your body. For example, you might have a feeling that the bugs are crawling on your skin or that your internal organs are in a continuous tactile motion. The first type of hallucinogens are the psychedelics. Psychedelics are defined as the broad range of drugs that affect the core consciousness and sensory perception. The mechanism of action of psychedelics are that they are agonist, or we can say they are partial agonist at the brain serotonin 5-HT2A receptor. They basically binds with the serotonin 5-HT2A receptor and they multiply their function. That is why they are called as the agonist, and their mechanism of action is agonism. The effects that psychedelic shows include synesthesia. Synesthesia are senses which are transmuted, so touch may be experienced as sound, etc. Under psychedelics, person alters sense of time and space. He or she have loss of ego boundaries, such as oneness, such as loss of individuality. The example of drugs that fall under psychedelics are LSD, psilocybin, DMT, mescaline, etc. LSD. LSD is one of the types of psychedelic, and it's the whole name of LSD is D-lysergic acid diethylamide. It is a hallucinogenic which is derived from a parasitic fungus that grows on a rye. It can be natural, it can be synthetic as well. LSD is produced as a crystal initially, and then it is dissolved in an alcohol prior to sale and prior to consumption. LSD users describe their experience on the drug as a trip. LSD was the first type of synthetic psychedelic which was discovered by Albert Hofmann. Albert Hofmann was that scientist who worked on multiple types of ergot, and 25th ergot was termed as lysergic acid diethylamide, and that is why LSD 25 is the most common name for this type of psychedelic. LSD has multiple names, has multiple street names, among which hippie drug is the most common one. Talking about the administration of LSD. LSD, once taken in the drug, goes through the body and gets absorbed in the stomach. Then the effect starts spreading towards the brain. The drug is thought to alter the neurotransmission of serotonin, dopamine, glutamate, norepinephrine, and epinephrine, and also other types of neurotransmitters. It is a psychoactive drug that affects primarily as a result of D2 receptor agonism. This D2 receptor agonism leads to drug induced psychosis, and that takes you to a trip, as it is called. Moving on to the second type of hallucinogens, dissociatives. Dissociatives are a class of hallucinogens which distort perception of sight and sound and produce feelings of detachment or dissociation from the environment or from the individual itself. They produce hallucinergic effects, which may include sensory deprivation, dissociation, and dreamlike states or trances. Dissociatives, such as phencyclidine, was originally developed as a general anesthetic for surgery in the 1950s. Laboratory studies suggest that dissociative drugs such as PCP, ketamine, DXM, they cause their effects by disrupting the actions of the brain glutamate at certain type of receptors, which means that dissociatives are that type of hallucinogen that work on the receptor, that work on the chemical which is known as the glutamate, and glutamate is a neurotransmitter which is present in the brain. So basically the dissociatives such as PCP, ketamine, DXM gets attached to the glutamate receptor and then further functions. Use of dissociative drugs can also cause anxiety, memory loss, and impaired motor function, including body tremors and numbness. The third type of psychedelic are deliriums. Deliriums are a class of hallucinogens, and the term was introduced by David F. Duncan to distinguish that deliriums are different from psychedelics and dissociatives because they are primarily responsible for causing delirium. The mechanism of action is similar to anticholinergic drugs, and they are responsible for inhibition of acetylcholine neurotransmission. The effects which are produced by the deliriums, it includes stupor, it includes agitation, a state of confusion, a state of dysphoria, also experiences by users, including holding full-on conversations that, like for example, the individual who's having a delirium will have a full-on conversation with himself in front of a mirror or with its own reflection in front of a mirror, assuming that there's a second person in front of him. So this is the effect that deliriums causes in the human body. These are some short-term general effects of hallucinogens, which consist of sensory effects, which consist of physical effects. Now, the long-term effects of hallucinogens include persistent psychosis, include visual disturbances, paranoia, mood disturbances. Also, there are other visual disturbances. There are symptoms that include neurological disorders as well. This is basically a chart which shows that how narcotics and how hallucinogens have affected the community of the world, and it shows that how there is an increased uptake of hallucinogens in the latest years. Now the case study. Case presentation. David, age 18, is brought to the emergency department by police for violent, combative behavior. Friends claim he was smoking a dusted joint, PCP. He appears agitated, diaphoretic, and disoriented. His blood pressure is 160 by 100 millimeter Hg, pulse is 130 meters per minute, and the temperature which shows is 101 degree Fahrenheit. He has vertical and horizontal nystagmus. Are these effects consistent with PCP intoxication, and how should David be treated? The SOAP notes. Subjective. The chief complaint for the patient is complaining about combative behavior after smoking a dusted joint, which is apparently PCP. His age is 18 years, he is a male, and the patient history includes he has vertical and horizontal nystagmus. Nystagmus is basically uncontrollable and rapid movement of eyes, which is a certain medical condition that is experienced by certain people. Current and previous medications are not mentioned. Objective. The vital signs include the blood pressure is 160 by 100 millimeter Hg, the pulse is 130 beats per minute, the body temperature noted was 101 degree Fahrenheit. Physical examination findings include on examination he appears to be agitated, diaphoretic, and disoriented. Assessment. The patient has been smoking a joint of PCP because of which he has experienced combative behavior along with a sense of disorientation. David's symptoms are consistent with PCP intoxication. PCP in low doses may cause inebriation, ataxia, changes in the body image, numbness, etc. As David already experiences horizontal and vertical nystagmus, which is, as I have told before, a condition in which the eyes move rapidly and uncontrollably. So after PCP intoxication, that the effect of the drug is so much that nystagmus increases, and also it may cause amnesia. With the increase in the dose of PCP, the patient may experience agitation, catatonia, and psychosis. A hypertensive response is generally encountered. Tachycardia, tachypnea, hyperthermia is also noted. Respiratory depressions such as seizures, acidosis, rhabdomyolysis, everything is compromised in this patient's condition. Now, the plan. Talking about the non-pharmacological treatment. In the non-pharmacological treatment, diagnosis, first of all, we have to diagnose the PCP intoxication by taking either a urine sample or a blood specimen. Once we are confirmed that the patient is intoxicated with PCP, so we will further proceed with our treatment. Currently, there's no such antidote which is present for the PCP detoxification, so the treatment should be supportive. First of all, we would have to minimize the environmental stimuli, which means the patient should not be externally stimulated, whether he should not be forced to do something, he should not be triggered with any other environmental stimuli. Also, the talk down is something every patient has been done, especially those people who are under any drug effect, especially those hallucinogens. The other people tends to talk them out, but in this case we don't have to make them calm, we just have to wait till the patient relaxes itself. Physical restraints may increase the risk of rhabdomyolysis and should be reserved for patients who pose the threat of great danger to themselves or to others. Now, that was a non-pharmacological treatment, and this is a pharmacological treatment. In pharmacological treatment, first, initially, we would have to give the patient benzodiazepines because benzodiazepines are useful in the management of anxious, agitated patients with mild to moderate PCP intoxication. The second line of treatment can be done with a haloperidol 5 mg intramuscular. Hypertension may be managed with beta blockers. Diazepam is also a useful anticonvulsant for the management of PCP-induced seizures. Activated charcoal should be given, that is 1 gram per kg every 2 to 4 hours, because activated charcoal is responsible for the elimination of the drug through urine, and basically it promotes its elimination and also minimizes or prevents the intestinal reabsorption of this drug. Moving on to the conclusion of our presentation, I would just like to say that how substance abuse or abuse has widely affected our society. Drug use and addiction cause a lot of disease and also a disability in the world. Recent advances in neuroscience may help improve policies to reduce the harm that the use of tobacco, alcohol, hallucinogens, and the other psychoactive drugs impose on the society. Since the effect of drugs on the health vary greatly, it depending on the type of the drug and on the way it is used, the public health response to the drug use should be proportional to the health related harm it causes. It means that the way we promote that how using of the drug is beneficial for our health, it is also our responsibility or the health sector's responsibility that we would also have to tell them that if the drug is beneficial, also the drug can be harmful to you. So the ratio should be balanced. Use of psychoactive substances is to be expected because of their pleasurable effects, so as well as social influences. The greater the frequency and amount of drug use, the higher the risk of becoming dependent on those drugs. Affecting public health policies and programs that address not only drug dependence but also other forms of harmful drug use could lead to a significant reduction in the overall health burden of the drug use. And this means that, as I have said previously, that public health policies should be designed in such a way, there should be programs in which we address to our public sector that how misuse of drug, how substance abuse is a thing, and we should consider that. Also, how we should minimize the hallucinogens, also the other psychoactive drugs, just for the sake of a few hours pleasure. So we should design such policies, such conferences, such workshops in which we can make the public aware of its dependence and of its highly extremely side effects. I hope my presentation is clear to you, and I hope you like this presentation. Thank you.